A 17-year-old boy was brought to the emergency department by his colleagues unresponsive. His skin was pale and almost lifeless. His name is Elias. His teammates from the karate surrounded the medical team. Their faces were frozen in shock and disbelief. They have just been sparring with him a couple of minutes ago. He was fine, he was laughing, and now here he is unresponsive. The emergency team immediately sprang into action. They began attaching the monitors and devices into his chest along with this BP cuff. The first vital they checked was completely devastating. His blood pressure was crashing. The numbers on the monitor were dropping very rapidly from 110 to 95, then to 70. As we all know, the normal blood pressure of you and me, it will be 120/80, and this emergency room become completely chaotic. The nurses were started to run, and then the doctors start to shout the orders, and the machines around the Elias begin to paint a grim picture of what was actually happening inside his body. An electrocardiogram or ECG were quickly performed. The machine printed out a strip of paper showing the electrical activity of his heart. But what doctors saw was not just a normal heartbeat pattern. Instead, the paper showed something chaotic and terrifying. What appeared to be a random, irregular rhythm with no clear pattern. The medical team immediately recognized it. Ventricular fibrillation, the worst possible heart rhythm. Let's step back in time and see what actually happened to this Elias. An hour ago, he was completely a different person. He had been doing what he loved the most in the world. Elias had been training karate since he was 6 years old. For the past 11 years, it has been more than just a sport to him. It was his identity, his passion, and his refuge. Throughout his teenage years, Elias had become something of a local legend at his region. He was the kind of athlete who made it look everything easy. His movements were fluid and precise. His kicks were powerful and controlled. He won multiple regional competitions. He had trained under masters with decades of experience. His instructors saw a championship potential within him. His friends looked up to him, and his parents were proud beyond words. That Tuesday afternoon in late fall, Elias showed up to his regular sparring session like he always did. There was nothing unusual about it. It was just another day at the dojo. Just another practice session with his training partner, a fellow student who was roughly his age and skill level. Neither of them was trying to hurt each other. They were both trained athletes who understand safety, control, and discipline. They were both wearing protective gear. This was routine. This was what they did together for several times in a week. The session started normally. Other students were watching and training nearby as well. Instructors were present as well. Everything was exactly as it should be. Then came the moment that would change everything forever. Elias' training partner threw a roundhouse kick. In karate, it is called mawashigeri. It's one of the most fundamental and powerful strikes in the entire martial arts. This was not a reckless or aggressive move. It was not a dirty technique or an illegal strike. It was simply a standard roundhouse kick performed during the sparring. The kick came from his opponent's left side. The foot rotated in a controlled arc. All of the force of the opponent's body's weight, his leg muscles, and his hip rotation was channeled into the top of the foot. The kick landed on the left side of Elias' chest. It struck directly over the precordium, the precise anatomical region directly over the heart itself, covered only with ribcage and muscle. This kick was not uniquely powerful, the opponent was not unusually strong or trained. In fact, the research shows that a standard roundhouse kick from an average martial artist can generate velocities of up to 18 miles per second with an impact force ranging to hundreds to thousands of newtons. Scientists have calculated that these forces are roughly equivalent to a blunt trauma someone might experience in a severe motorcycle accident. But on this particular Tuesday afternoon, something extraordinary rare has happened. The energy from the kick compressed the Elias' chest wall. That compression created a sudden surge of pressure inside his chest cavity. Elias' heart's electrical system short-circuited. His heart did not bruise, his heart did not tear, and his heart was structurally completely intact, but his heart's ability to function as a pump was instantly destroyed. The medical term for what happened to Elias is Commutio Cordis. The Latin word literally means agitation of the heart. To understand what happened to Elias, we must first understand how the normal heart works. Your heart is an electrical organ as much as it is a mechanical pump. At every moment of every day, your heart follows a precise electrical sequence. The sequence that starts with sinoatrial node, or as we call SA node, often called the heart's natural pacemaker. It sends out a signal. This signal travels through specialized pathways in the heart muscle. Atrias are the upper chambers of the heart. This pushes blood down into the ventricles, the main pumping chambers of the heart. From the ventricles, the heart will pump blood into all over the body. This entire cycle happens roughly 60 to 100 times per minute throughout your entire life. Each heartbeat is a part of a critical electrical pattern that repeated continuously. One of the most dangerous moments in this cycle is called vulnerable phase. This occurs during a portion of heartbeat. It's called T wave that is visible on electrocardiogram or ECG as a specific bump on the electrical tracing. The vulnerable phase that lasts only about 20 to 40 milliseconds, that is 20 to 40 thousandths of a single second. Here is where Commutio Cordis becomes so extraordinarily rare and yet so extraordinarily deadly. If a traumatic blow to the chest that occurs precisely at the right moment during this vulnerability phase, that's from 20 to 40 milliseconds, then something catastrophic can happen. The sudden pressure from the impact activates specialized proteins in the heart muscle cells that is called stretch sensitive ion channels. These channels suddenly opens up. When they open, they allow abnormal electrical signals to flood through the heart muscles. Imagine a computer server that processes information in a very specific way, in an orderly way. Now imagine a massive power surge that crashes into that server without warning. The entire system will go out, right? That is what happened to the heart during Commotio Cordis. The organized rhythmic electrical activity is shattered, chaos takes over, the ventricles, those powerful main pumping chambers, begin to twitch irregularly. They twitch thousands of times per minute with no coordination whatsoever. The heart is no longer a pump, it becomes useless trembling mass of muscle. Blood stops flowing to the brain and organs because heart is pumping irregularly. The body is being starved of oxygen by the second. When doctors look at Elias' electrocardiogram in the emergency room, they were seeing the devastating result of this electrical chaos. The ECG show what's called ventricular fibrillation or VFib, instead of normal organized pattern of heartbeat that indicate a functional heart. In ECG, as you guys should know, there are a couple of waves like P waves, then QRS, then T waves. But when there is ventricular fibrillation, there were no identifiable P waves, no QRS complex, nothing. The ventricles were firing at rates between 150 to 500 times per minute, each beat completely uncoordinated with others. It was the electrical chaos written out on a paper. It was a heart that had stopped functioning as a pump. In the emergency room, the doctors recognized immediately what they were dealing with. Ventricular fibrillation is the most dangerous heart rhythm that exists. Without immediate intervention, it is almost universally fatal. The emergency team does not even waste a second. They initiated advanced life support protocols immediately. They began performing chest compressions, pushing on Elias' chest with rhythmic force over and over again. They did this to try to manually pump blood throughout his body and maintain some level of oxygen delivery to his brain and vital organs. They placed a defib on his chest, a machine that is designed to deliver an electrical shock to the heart, attempting to restore a normal rhythm. They administer medications designed to support his heart function and his blood pressure. Adrenaline was pushed into his veins. Elias' rhythm remained as ventricular fibrillation. His heart did not respond. His blood pressure remained dangerously low despite all the efforts. Despite the expertise of emergency team, the sad truth about Commutio Cordis is that it carries an extraordinary high fatality rate. According to medical research, if a patient does not receive cardiopulmonary resuscitation or CPR with defibrillation within 3 minutes, the chance of survival drops to just 5%. The longer the brain goes without oxygen, the more damage it occurs. Each passing minute represents the millions of neurons they are dying. The paramedics who brought Elias to the hospital had initiated CPR immediately at the dojo. They had called for an ambulance within seconds of his collapse. They had done everything right, but even with the fastest response, even with the most immediate interventions, the dice had already been rolled. The emergency team managed to stabilize him enough to move him to the intensive care unit. He was placed on machines to support his breathing. His circulation was supported by medications and equipments. But Elias never regained consciousness. His parents kept vigil by his side. His friends came to the hospital in stunned groups, unable to process what had happened. His coaches and instructors came, struggling to understand how a routine training session could end like this. The ICU team continued to provide the maximum support. They gave him nutrition through tubes. They monitored his brain activity. They adjusted medications constantly, trying to find any combination that might help. They performed tests and scans to determine the extent of damage. During those 5 days, Elias has developed additional complications as well. His lungs begin to fail, his kidneys begin to shut down, and his blood pressure becomes harder and harder to maintain. Commotio Cordis claims its victims not just in moment of impact but in the days and hours that follow. The initial cardiac arrest causes oxygen deprivation into the brain. It causes irreversible damage. Even if the heart's rhythm can be restored, even if the patient can be kept alive by machines, the brain damage persists. Elias' family had to make an impossible decision. On the 5th day in the ICU, Elias was pronounced dead, 17 years old. A promising young karate athlete. Cause of death was listed as Commotio Cordis, sudden cardiac arrest due to blunt trauma to the chest during a vulnerable phase of cardiac cycle. Many cases occurs in young adults. Baseball has historically reported the most cases to the hardness of the ball and the speed of the projectiles. But football, hockey, lacrosse, even karate had reported the cases. Most importantly, the survival rate depends almost entirely on the response time and immediate access to defibrillation. When CPR is started within 3 minutes and defibrillation is available, survival rate can reach even up to 58%. But when response is delayed, when a defibrillator is not available, when there is any lag in intervention, survival rates will start to drop to zero. The story of Elias raises important questions about sports safety, about medical preparedness, and about the hidden dangers. that exist in everyday athletic activities. Commutio Cordis cannot be predicted. It cannot be prevented with equipments because the blow in Elias' case was not unusually forceful. It cannot be prevented by rules or restrictions because the strike was entirely legal. Only be managed through preparation and response. This means that every athletic facility should have an automated external defibrillator available. Every coach should be trained for CPR. Every school should have an emergency response plan. Every parent should understand that sudden cardiac arrest can happen to young athlete at any moment, and Elias' life was cut short in single sudden unexpected moment. But his legacy, the awareness he helped to bring, the conversation he sparkled, the potential lives that might be saved because of this story, their legacy will continue forever. Thank you so much.